everybody. This is Tim Mitchell with Pharmacy Frontiers Podcast. I'm not sure what episode we're on, but unfortunately, Daniel's not able to be here today. He had an important job thing going on, and he's got a position that requires him to do some traveling. I believe he was traveling today, so he's unavailable. Today, I've got a good friend of mine. Before I get too much further, I just want to remind everybody to like and share our podcast with your friends. Pharmacists, non-pharmacists, technicians, doesn't matter who, anybody can listen to learn more about what happens in pharmacy. And just keep in mind that the opinions and comments that are mentioned on this podcast are our own, not necessarily represent that of Missouri Pharmacy Association, who helps us put this podcast together and roll with it. Today, I have a good friend of mine, Nick Smock. Nick is from Kansas City area. He is the CEO of PBA Health. And I wanted to have Nick on because he has a unique vision of or a unique area of pharmacy he works in. He's been a pharmacist. He is a pharmacist, I should say, and runs a company that supports community pharmacy throughout the nation, not just Missouri. And I look up to Nick. Nick's like a brother and has given me advice and has helped me out over the years. And I know he's helped a number of my friends and people I don't even know all over the nation. And to be honest with you, whenever I go to somebody and I talk about PBA Health, they say, "Oh yeah, that's Nick Smock. Yeah, I've known Nick for a long time." So Nick, welcome to the show. Appreciate you being here. And for those people that don't know you, why don't you kind of give us a kind of a general synopsis, kind of tell us where you grew up, that whole thing, and introduce yourself, and then we'll roll from there. So, all right.
Sure. Well, thanks, Tim. Hey, it's wonderful to be here, and I'm honored that you asked me to actually come to your Pharmacy Frontier program. So thank you very much for doing that.
Hope it turns out good.
Yeah, there you go. Really, I've been in pharmacy ever since my dad graduated from pharmacy school from UMKC in 1958. That was the year I was born, so I'm kind of telling you my age. And I worked at his drugstore up in St. Joseph, Missouri. For those of you who don't know, that's the home of the Pony Express, where that started, the mail route to San Francisco, and the home of Stetson at one point in time. But I worked for him, as a kid, and watched him growing up. And you talk about patient care, whenever we had the store up in St. Joseph, I mean, he was open like 9 Monday through Saturdays, and then part-time on Sundays. But after we closed the store, he'd actually flip his phone over, so that way it would actually ring to like a red phone in his bedroom. So that way, if somebody had to get a prescription filled after hours. So that was the patient care that, I grew up with. And I was a delivery boy for him for a number of years. And you talk about community health workers, I delivered a lot of stuff for a lot of people, and we were providing, community health care at that time, when even if the lady had asked me to, change her light bulb out or something.
That's a community health worker. That's a community health worker right
I
there.
know, that's it. That was it. And so I did that. And then I actually worked at C.D. Smith Drug Wholesale up in St. Joseph as well. And then I decided, I really knew pharmacy. And pharmacy, I loved the idea of pharmacy because it had to do with health, and trying to understand how the drugs in the body works were kind of like an anomaly to me. So I really wanted to get into that. But it also had to do with business, because I saw how he actually ran his pharmacy and how it provided for us as kids and going forward. But I got out of pharmacy school at UMKC in 1983. And I was working at Menorah Medical Center at the time. They offered me a job, but I wanted to do something different. So I started probably the first pharmacy relief service in this area out of Missouri and Kansas.
Great idea.
Missouri and Kansas license. So I actually gave him his first 2-week vacation. He never did trust anybody to come over there and work. So he went out to see my sister out in California, and because she just had set of twins. And so he left for 2 weeks, gave me the keys to the store and said, "Here, run it like it's your own."
There you go.
And I did it, and it was great. So then I started working for a number of his friends and all around the state, and just doing relief work. And then, I hate to say it, but then the chains got a hold of me, and they found out what I was able to do, and they hired me as their troubleshooter for Revco, Reliable, and Osco, and I did all that. And during that time period, I went back and got my MBA in finance and marketing from UMKC. block school of business. And then when the PharmD came out, I did the non-traditional PharmD at UMKC as well. So I got 3 degrees from that university. And I will say this, about that. Yeah, I still say that's probably one of the best educations I've ever had was, the pharmacy school. What I learned, I mean, it really really catapulted me in my life, and things that, the empowerment I got from just that knowledge. And so I did that as I was working for Osco at the time, because they had just bought out some of the reliable drugstores out of Kansas City. And I told them I'd give them a year. And I said, after that year, if I don't see things moving in the direction I think they need to be, where they're taking care of the pharmacists and also taking care of their patients, and I'm going to move on. So all of a sudden I landed at PBA. It was called Pharmacy Buying Association out of Kansas City. So they started actually this organization in 1983. And Dean Strickland was one of the UMKC deans at the time. Dr. Jack Gumbeer, marketing guy from UMKC. Number of people in Kansas City, Howard Stark, members of the American College of Apothecaries. I don't know if you all know who those are, but I'm the president of that organization right now. It's a nonprofit pharmacy-based value business that's out of Tennessee. But anyway, so I'm just there serving as I can and bringing any knowledge and capabilities I can. But got here in 1983 and brought a lot of the independent, saw what they really needed, and took some of the education I got from the chains that I worked for and I ran, and I was very good at that because I was brought up under the philosophy of taking care of the patient or the customer first, and then the business should take care of itself. As we know with the PBMs, though, as they got into business doesn't, we have to take care of the patient and the business today. Absolutely. So, when I got to PBA, I looked at what we were doing here, and we started as a retail GPO in 1983. And one of the organizations, that's how we got our association with Missouri Pharmacy Association. They had a buying group, and they didn't really want to run that. So what happened is they took that buying group and let it merge with PBA, Pharmacy Buying Association at the time. So, we were able to go out and negotiate pricing for the generics, because at that time, the Wax-Hatchman law just came into effect, where you didn't have to go out and do all the NDA, new drug application studies. You could do the abbreviated new drug application, the ANDAs, ANDAs. And so, a lot of the chains were getting good buy prices. And so the independents really didn't have anywhere to go. So they started this organization for that. So I always said when I got here, I said, there's 3 things. The only 3 things you need to be able to do to be successful in any business. And I always call that my BOSS, BOS, buy, operate, and sell. You got to buy effectively, operate efficiently, and sell profitably.
Great advice.
Yeah. So what we did at PBA is, we really focused on that buy side. We didn't go out and pick sites for people on their operational side, but then we also had our third party. We had a small PBM at the time too, because some of the plans we couldn't get into as pharmacists. And so we started a, kind of like a transparent PBM, if you will, and third party network. So that's how I got here. And I got here in, it was 30 years ago this last July. And I graduated pharmacy school 40 years ago.
And I just turned 30 last year, so not really.
You look like you're 30.
Yeah, I'm 30 years old. I'm a fat, old-headed man that's 30 years old. So that's a wealth of knowledge. I mean, listening to all the things that you have, you've got quite a history in pharmacy, and it's pretty amazing to hear. I mean, I've known you for a long time. I didn't know you had your own relief pharmacy group or started that. And to be honest with you, back in those days, it probably didn't even exist anywhere. It's probably just your idea of, hey, we're just going to have a company and we'll go around and take care of people. So,
and I want to say something about that, Tim, because back then that was so I graduated 83. So pharmacy was just getting into the technology age at that time. So to be able to go, and they had different computer systems, as you all do now. I know you have a certain one, and we've endorsed various different ones here at PBA and all. But, to be able to go into that pharmacy and really run that pharmacy, and they didn't have, at that time, the techs weren't doing as much, or really there wasn't that many techs out there. So
Right.
you'd have to actually go in and be adaptable enough to be able to fill those prescriptions like I did for Charlie Johnson down in Main Street Pharmacy in Lexington, Missouri. I mean, he had a different system. So it was hard for me to get other pharmacists that were nimble or as, I don't
Hey,
know.
that's my word. I like nimble. I like
Yeah,
nimble.
like one of those, just being able to go there and be astute enough to be able to fill those prescriptions because they didn't have it. Today, if you go as a relief pharmacist, usually the technician does a lot of that.
Yeah.
And they have I love it that these technicians are taking on more responsibilities and more duties. I think that's great. But then, today they're the ones that kind of running the system. So you could actually be a relief pharmacist today and go to another pharmacy and still fill their prescriptions and not necessarily know how Pioneer or Computer RX or, who at Liberty or whichever system that you're on. So
Sure, absolutely. So I want to ask, talk a little bit more about you personally. So I was looking at your information you sent over. You're licensed in multiple states. Tell me why you're licensed in other states. I mean, have you worked in
yeah,
those states or what's
yeah.
going on?
I keep those up. Of course, graduating from UMKC here in Kansas City, it's right on the border of Kansas and Missouri. So that's kind
Okay,
of a
so
no.
there's two.
Yeah, that's two. And then when I started the non-traditional PharmD program. They started at University of Arkansas. So I enrolled in there. Yeah, so you had to actually be a pharmacist in Arkansas to be able to do it. So I got my license down there. And long story short on that, then I was on the Dean's Advisory Council and the CAR committee, the Committee for Academic Requirements and Admissions at UMKC. And they said, we started our program. You need to come back here. I said, okay. So I even had to take biostats again and the whole 9 yards. But I came back to MKC and did that. But back then when I was younger, I did have a girlfriend that actually lived in Texas. And so we were looking at maybe I might have been yeah. And quite honestly, those guys down in Texas, that was one of the first consolidations that PBA did in the country was with Legend of Texas Pharmacy Co-op.
I remember
PBA
that.
got together.
Yeah,
and that was part of it because I was a Texas pharmacist at the time.
Gotcha. Well, that's cool. So when did you graduate with your PharmD, your non-traditional PharmD?
2002.
Okay, cool.
So, and I had to go through all the, then you had to do like 7 rotations. You had to do some didactic stuff, and I did that on videotape, believe it or not. They actually sent me the videotapes. I had to watch them, and I did that, took tests. But then you had to do 7 rotations. But because of my work here at PBA, I was able to test out of, if you will, 2 of them. So I was able to do this. So I had to do 5, 1 month rotations.
Awesome. Well, that's amazing. So president, CEO of pharmacy or PBA Pharmacy Buying Association.
That's a corporate name out of Missouri.
Right. So tell me a little bit about, and then this is not a commercial for PBA Health, but tell me what PBA Health is and what goes on at PBA Health.
Yeah.
What's your day look like? What do you do? And then what goes on in PBA?
Well, first thing was to really figure out what the pharmacies needed. And again, it goes back to that buy, operate, sell. How can we, with the intuitiveness or the capabilities that we have here, how can we help the pharmacies buy, operate, and sell more profitably, right? So the first thing when I got here in it was 1994, we didn't have any data. So we really need to we were getting green bar reports. So one of the things I needed to do is be able to get our members data to help them get better deals or better pricing, so on and so forth. It really started that way. And I couldn't do it without the people here. I don't know if anybody knows Clark Balcom. He's my right-hand person, Chief Operating Officer. Yeah, you know Clark. And he actually grew up in the restaurant business, but he has a degree in finance and technology. And so I was on the business side in pharmacy. So he actually trained me somewhat on the technology side, and I trained him somewhat on the pharmacy side. And we made a real good partnership with that. And we were able to do a lot of things for the pharmacy. So, today, like say, the biggest thing we do still is on the buy side, because with the lower and lower reimbursements, and it's getting to the point where you can't really buy yourself into profitability with it. I've been saying this, even if we could actually give another, say, 5, 10, 15% rebate on generics, will that move the needle? So I've always been an advocate of, going out there and trying to do legislation to where we actually say, hey, can we actually go back to the professional fee and go back to the NADAC. So we're really a big proponent of that because the pharmacies really need to make something on their inventory, but also have a professional fee. Now, some of the PBMs insurance companies dumbed that down and made it into a, quote, dispensing fee. But that dispensing fee doesn't cover the vial, the label, nothing.
Yeah, most of the time they don't even pay a dispensing fee anymore. They'll say your dispensing fee is zero.
That's exactly right.
And then
Zero.
we're going to take a negative amount on your reimbursement. So
Yeah.
you know, it may cost you $10. We're going to let you get $8, and we're not going to pay you any dispensing fee at all. So
yeah,
so, it's a challenge.
So when we got together, we got Clark and the board at PBA. We had a meeting at a retreat, and we looked at what, you know, we try to look at things to the future and go to the future and then walk back to the present. Because there's a lot of things that naysayers, oh, you guys can't ever do that. You can't ever do that. We heard all that. But, you know, you got to take yourself out of that and go out to the future and say, oh, what do you see going to happen? You know, what's going to be the best thing for our core business, which is independent community pharmacy. And so we, you know, went back there. We looked at it. We said, oh, should we do wholesaling? Should we do a PBM? Should we be a software company? Should we be a, you know, managed care company? Should we be a PBM? We looked through those, and we really went all through all those. And so we knew that the first thing we needed to do is, you know, basically provide additional savings, you know, cost of goods to our pharmacies. And so that's really where we went to work at. And we opened up the distribution center, I think in 1998. But we actually built that. We started getting the data from the pharmacies. We were able to go back to the manufacturers, you know, whether it was a brand like AstraZeneca down to, I don't know, Zenith Gold Line, if you remember Zenith Gold Line. They were a generic company. So we actually went out and negotiated prices, and we'd do that, and we'd have them loaded at your wholesaler that we had an agreement with. That they agreed to go ahead and pass through that pricing to them. And then eventually what we needed to do, because the wholesalers got to the point where they didn't want to pass all those savings on, so we decided to go ahead and open up a distribution facility, and that's when we did that in 1998.
Well, that's amazing. And, you know, I had the opportunity to tour the distribution center probably, a year or two ago. And I will tell you, I was thoroughly impressed. I mean, it's like a full-fledged warehouse, in my opinion. I mean, I know warehouses can get huge, but I really just thought you guys had like a small area. There's a huge building. And of course, it's separate from your corporate offices in Kansas City. So if somebody wants to learn more, and again, not mean to be a commercial, if someone wants to learn more about PBA, how can they connect with PBA to learn about, you know, what kind of other services you guys offer and so forth, or maybe even to become a customer?
Yeah, all you got to do is call, you know, 1-800 number 333-8097. That's 1-800-333-8097.
Yeah,
or they can, you know, email me, whatever they want to do. You know, today, I was going to say where things have changed today, it was easier before on the buy sell than it is today. Today, you know, even in my MBA program, we learned about this black box, right? And I know some people call, you know, what Clark and his team does, you know, in the IT, kind of like the flux capacitor. You know, like
it is the flux capacitor. It is the flux capacitor.
But today you really need that technology. And most of the times, you know, a lot of things that we offer, most of the pharmacies can't afford. They don't have the capabilities or the characters or the capacity to be able to do that. We've been able to do that with the people who actually do that. So we have the character, we have the capabilities, we have the capacity. So we've been able to build that to where, you know, with the wholesaler contracts today are so intricate, or maybe you want to use that word nimble, you know, that I said earlier, but, you know, they're so refined. It's kind of like that black box, you know, like arbitration, like say trying to do a stock trade, so to speak. But anyway, so if you look at that, we're able to take that information on a day-to-day basis and get the pharmacies their apex, right there at the apex, where they get their highest discounts, rebates, whatever you want to call it, at that point in time. And if you give too much, it could be the law of diminishing returns. So that's where we actually use the warehouse to kind of infiltrate that, to be able to keep that apex keep going a little bit higher and higher.
Okay, that's cool. That's cool. Well, so we've learned a little bit about Nick. We've learned a little bit about the company that you run. Tell me where you think pharmacy is going in the future. Where we're at right now, and you've alluded to some of the things. Where do you see pharmacy in the next, 5 to 10 years? Do you see us still doing what we do today, or what are your thoughts?
Well, my thoughts on that is you don't know, we have a license to be able to have the drugs and dispense the drugs.
Right.
So I don't think we ever want to necessarily let that go.
Agree.
I think, because you don't want to go back there to the board of pharmacies and have them change their, their criteria and all. I mean, we got that. There's no other profession that can do that. Okay, some of the doctors that actually can dispense, I got that. But I don't think you want to do that. I think what we want to do is we want to expand that practice and do more kind of the consulting. So if you look at one point in time where, like IBM was, where they quit making money on their machines, what they ended up doing, Lou Gershner did, he ended up getting into more consulting. I think we as a profession and the education we have is phenomenal. I mean, we've been there. You all know the classes that you've taken and all, but we ought to be able to go out there and be able to charge somehow, some way for those services, more of a consulting. And I think whether it's a community health workers, like you were talking about earlier, which I think most people don't want to leave their home. They don't want to really go into a long-term care facility. Some of them will, but most people want to stay at home. So if there's any way we could actually take, the knowledge we have and be able to expand that into the, the more of a consulting type, if you will, and be able to charge for it. Now, that's been one of the dilemmas I've always heard from a lot of pharmacies out there. Well, nobody wants to pay for it. Well, have they really tried to do that? And that was one of the things in my mind, if I went back out into practice, I would try to do that. Say, maybe you get an iPad, go out there and talk to Mr. or Mrs. Smith, who knows, whatever. And you could cover a lot of areas with their health, especially the drugs, whether it's environments, so on and so forth. But how would they pay for it? Now, I always go back to, well, when you're wanting to create a will, are you willing to pay the $300 for an hour for the will? Most people do. And so if we could do that, I think that's really where it needs to go, Tim. But we still need to hang on to the dispensing of the medication. And if we can get to the point where we got federal legislation as well, being able to, say, charge or reimburse at NADAC. I mean, this reimbursement thing has just gone too far on the PBMs. We've been fighting that thing since 1983, since I got out of pharmacy school.
Right. Yeah, it's crazy. It's absolutely crazy. So what are you thinking provider status for pharmacists? Do you have that? Do you have that thought?
Yeah, I think provider status.
We could build the medical side for provider, consultations, or if the patient doesn't have insurance, we can charge, them a fee just like what a physician would do.
Well, if you remember back in COVID, I think, when COVID, pandemic happened, and they needed people in the local areas. And thank God, I mean, one of your people that you trained with down in Arkansas, I think he ended up administering like 20,000 vaccines or something like that.
Yeah, and I think he distributed over 100,000. Sounds like it's what he was telling me. It's crazy.
Well, that was probably true, but I think that one year he did 20,000.
Yeah.
But, the thing is we got an administration fee or a professional fee for that. It's like $40, right?
Right.
And, that's the stuff we got to be able to do and provide. And, at that point in time, we didn't have to worry about the reimbursement, which was great because, the government, I think the government should pay for everything, but, the government paid for that. And so, I think, if we still got to hang on to the product and we got to get the legislation in there to where we can make a fair and equitable reimbursement on providing that particular service, but also expand out and be able to do more of the consulting things, whether it's, diet, exercise, and we've all heard this, asthma, COPD, whatever it is, and really get involved in that and really have people pay us for that type of information. The PBMs probably will never do that.
Well, they're trying to, but I think honestly, a mistake would be to give them control of that part of our business, because if you do that, you'll see what happens. It's going to same thing happen with your dispensing part. That being said, we can build Medicare right now for diabetes consultations through if you're an accredited diabetes program and if I remember correctly, back in the 90s, PBA started a diabetes care program that helped do that. It was kind of before its time, actually.
Yes.
And now NCPA and some of the other groups have actually rolled this out with Travis Wolf, and help people become accredited, and they're getting paid for those kind of consultations. So what you're saying is happening. It's not happening on a broad scale that we'd like for it to be, but it's getting there. It's getting there. So
yeah, we had when we did the consolidation or the merger with Texas Pharmacy Co-op, they had a nurse on staff, and so we utilized her. So we'd actually go out into an employer group, and we'd actually do blood pressures for all their employees and do a health, like a soap note, so to speak.
Yeah.
And it was amazing amazing that how the employees really liked it, but also the owner of the company that did that. It's just phenomenal.
Yeah.
And we got paid for that. And you can do that as a pharmacist. You don't have to quote be a nurse, but I've always said that we got to expand what we do as, high touch, high talk, high technology.
Absolutely. So we're kind of winding down here. We got probably about 4 minutes left. I'd like to kind of hear off the subject, not necessarily pharmacy related, but what kind of things do you like to do? I mean, I've talked to people, and it's like, sometimes tell me something about you that not everybody knows. That's an interesting thing. I mean, it doesn't have to be controversial. Please be careful. This is rated G now. So.
I get it. Well, there's two things I like to do. I love motorsports.
Oh.
And I love exercise. So, I have a couple crotch rockets, and I used to take them down to Heartland Track down here in Topeka, Kansas, and we'd have race days and stuff like that. And these are those crotch rockets that go from 0 to 60 in 2.6 seconds. So I always like that. So that's great. Don't do that out here on the road. No. But also, exercising, do health wise. I tried to take everything I learned in pharmacy and apply it here. But exercise is one of my big things, and I've been doing Bushido-Kon karate out of Kansas City for by about 30 years, almost 30 years. Yeah, 37 years by the fact. And
so do you have like a sensei? Do you have a sensei?
Yeah. And I used to do a lot of sparring. We trained a lot of fighters. And I just heard this year, actually, me and another guy who actually came in at the same time earned our black belts. And it's one of the dojos. It's probably the hardest place to get a black belt in Kansas City, if not the nation.
Well, that's amazing. That's amazing. Well, I appreciate you sharing your story. I know it's been a journey, and I know there's still lots going on in pharmacy. A lot's changed over the 30 years, or even longer than that since you've been in pharmacy. But that being said, I appreciate you coming on today and being our guest. I just want to remind everybody that, the profession's changing. And I think he used the word nimble a few times. That is kind of my word. I think it's important that community pharmacists and pharmacy in general remain nimble, try to put the care of our patients at the forefront. We still got to make a living. And I know sometimes it can be very disheartening to see all the crazy things that's going on, but it can be also, there's such a future, I think, in the profession, that it just blows my mind, some of the things that we can accomplish. So, and with the support of PBA Health and your people that work there, whether it's they're just buying medications or if they need, other specific advice. I know I've picked up the phone and called you guys many times, and you guys have been very supportive of just about even if it's an off the wall question about something. So feel free to call Nick or Clark or any of the guys at PBA Health, and I'm sure they'll be glad to try to help you. Nick, thank you again. Appreciate your time. Look forward to chatting with you again down the road. So.
Hey, Tim, thank you. And thanks for all the viewers being on here. Appreciate it. And never give. Was that what you wanted?